We are talking with Brandy from Prairie Lakes, and we're going to talk about occupational therapy services. Good morning, Brandy. How are you doing today?
Good morning. How are you?
Hey, doing good. Good to have you with us here this morning. So let's talk about OT therapists and the services that you guys all have at Prairie Lakes.
Sure. Occupational therapy is a job that we do that we provide services to people of all ages, and we kind of work on occupational therapy. Sounds like we're going to give you a job. We're not. What we're doing is we're giving you the skills for the job of living. So whatever those skills are that you need to do throughout your lifespan, throughout your development, those are what we're going to help you work on. I personally do mostly home health services, so I go to people's homes and work on whatever their needs may be in the home to make them as safe and independent as possible with we call them activities of daily living. So whatever they need to do for their activities of daily living. So that's what I do. We have other therapists. We have therapists who work in the hospital. Acutely is what we call it in the inpatient setting. And those are people who are working with you when you've been in the hospital, whether you've been sick or after a surgery. And they're going to try to get you ready to go home as quickly as possible and as good as possible before you leave.
Sure.
And then we also have outpatient therapy, and that's where you come into the specialty clinic and that they will see you after an injury or surgery or a life event that they can help you with there.
Sure. So it really encompasses a lot of different things. Let's talk a little bit about where you said you work a lot with the home health side of things. What are some of the things that you help people out with that maybe they're going to be struggling with?
Yeah, so we do a lot of things in the home. Our biggest job is to keep them in the home. I think a lot of people get worried for when home health comes in, they think we're going to kick them out of their home, but our job is actually to keep them in their home and to keep them out of the hospital. We might be going in there and providing, I do a lot of home safety kind of things, making sure that they can get to the bathroom safely, they can get in and out of a shower. As you get older, that gets a little more difficult. And so maybe it's just a matter of recommending some grab bars or putting in a shower chair, or as far as the toilet, maybe just getting a little bit of a riser on there so it's easier to get off of. So if somebody has like a back surgery, maybe it's hard for them to get out of bed. So we might just teach them a technique to get out of bed or give them a bed rail. So and sometimes it's just a matter of like you've had pneumonia or some kind of illness that's really knocked you down. Then we're going to work on some strengthening and some endurance kind of stuff to get you back going so that it's easier to do your everyday things.
Absolutely. And I'm sure you have a lot of happy clients that after you've helped them and just improving their quality of life at home.
Yeah, that's what we hope. It's rewarding when you can tell that you've made a difference, that maybe they thought they were going to have to go to a nursing home or something like that, but you've been able to go in there. Or some people think, I'll just never be able to take a shower the rest of my life. They're scared to get in and out, and you can go and just fix that for them. And that's rewarding to know that you've done that.
Absolutely.
For them, for sure.
And there's so many different things, so many different items that they have out there that help people stay in their homes longer, like you said, like even a shower chair or a lift to a toilet.
Yeah, there's a lot of different options out there for them. It's just a matter of figuring out which one's right for that specific person, and that's where OT comes in, and we can help make the right recommendations.
Absolutely. Where can people find out more about Prairie Lakes and your OT services?
You can go to prairielakes.com, or you can give the hospital a call at 605-882-7000.
All right. Sounds good. Great job, Brandy. And I got to tell you, I had knee replacement surgery a couple years ago, and it's one of those things where some of those easy tasks definitely aren't easy anymore, and I can definitely see where that would be helpful.
Yep, just a little bit of guidance sometimes makes a big difference.
Absolutely. Thanks so much, Brandy. You have a great day, and we'll talk with you again, okay?
Okay, sounds good. Thanks, Jimmy.
Brandy.
Bye-bye.
Yep, see you later. And that's Brandy, and she's an occupational therapist with Prairie Lakes. And I tell you what, Benny, there's so many good things that they do there with the occupational therapy, and really it's a godsend to a lot of people.
Yes, it is. Yeah.
Yep, absolutely. Trying to stay in that home as long as you can and make things a little bit easier. Like I said, with knee surgery, it's like, this used to be easy. I have no idea what I'm doing here.
Right.
So definitely can see where that's a big benefit for everybody.